Hi, everyone. Thank you for joining us. My name is Allison Campbell, Communications Supervisor here at the Brant County Health Unit. Here with me today, I have Dr. Rebecca Comley, Acting Medical Officer of Health, and Dr. Joanne Tober, BCHU CEO. Before we begin, can we please do a quick roll call for all joining us? Please state your name and affiliation.
Vincent Ball, Brantford Expositor.
Patty Berardi, Rogers TV.
Thank you. Prior to starting, we kindly ask that you self-mute your lines to minimize any background noise, and there will be an opportunity to ask questions upon conclusion of the statement. I'll now turn things over to Dr. Comley.
Thank you for joining us. Today, students in our community return to in-person learning. It's understandable that some parents are nervous, but as I've stated before, I believe it's the right time for students to return to the classroom. The Brant County Health Unit continues to work alongside our school board, independent schools, and our child care partners to implement and support measures that promote a safer environment for all students, teachers, and education workers. The return to in-person learning will affect everyone differently. When making the assessment of what works best for your family, remember to use reputable, trusted sources of information. It will take a collective community effort to reduce levels of COVID-19 locally to help make childcare school settings safer, and we can all do our part by getting vaccinated, including receiving booster when eligible, continuing to follow public health measures, and very importantly, staying home when you're feeling ill. BCHU continues to increasing the vaccination rate of children and our students in our community. Vaccination is one of the key measures parents and guardians can do to children as they return to the classroom. There continues to be many available appointments at our vaccine, as well as walk-in opportunities for second doses. The National Advisory Committee recommends an 8-week interval between the first and second dose for children aged 5 to 11. Evidence shows the schedule produces a stronger, longer-lasting response. The province also asked public health units to work with school boards to offer in-school voluntary vaccination clinics during instructional hours. As details are finalized, more information will be available regarding. Yesterday, our online was updated to allow eligible residents to book a 4th booster dose. 4th dose appointments are available for moderately to severely immunocompromised individuals who received their 3rd dose of COVID-19 vaccination at least 12 weeks or 84 days ago. We'd ask that residents please check who was eligible before booking a 4th dose. Only eligible citizens will receive a vaccination. Residents of long-term care homes, retirement homes, elder care lodges, and elderly living in other congregate settings are also eligible to receive a 4th dose 12 weeks after their 3rd dose. Individuals who reside in these settings do not need to make an appointment, as BCHU will be organized clinics so that these residents can receive vaccines on-site at the applicable facility. For a complete list of populations eligible to receive a 4th dose, please visit our website. Thank you.
All right, thank you, Dr. Comley. We'll now open it up for questions.
I guess one of the questions that I had is, have we entered the phase of the pandemic where it's really up to individuals now, in the sense that we have to learn how to live with COVID-19 and live with the disease? Have we reached that stage yet?
I think we're transitioning to that stage. We're currently seeing a high degree of community transmission, and also we're continuing a high level of hospitalization because of the level of community transmission. I think certainly we are actively managing outbreaks in high-risk settings. For lower-risk individuals, you're right. The most important thing now is to manage your own personal risk. Staying home when you're sick, telling your close contacts, vaccinating if you're eligible. These are the main things that we can, as individuals, can do. So I would say we're on the way to that place, but we still have a significant burden of disease in the community because of the hospitalization rate.
Okay. All right. Now, we talked a little bit earlier, I think you mentioned something about vaccination clinics, voluntarily vaccination clinics in the schools. Do you have a sense of when that might be starting yet?
We're having conversations with the school boards and also getting information from parents through the school boards to see who is interested and receptive to having their children back in context. So we're getting some information gathering first so that we can be a bit targeted with our approach, go to the schools with the highest need as well as with the individuals.
Okay. All right. I think that's it for me. Thank you.
Thank you.
It's Patty from Rogers. Some public health units in Ontario have said that they'll allow for people to report rapid test positivity to track in schools and things like that. I know there's a great concern among families in Brant as to whether or not their child has been in contact with a positive case in their classroom and concerned about that 30% threshold for the whole school. Do you know locally if our schools and our school boards will be adopting that approach where they actually let people know before that 30% threshold?
I can tell you, I can't comment for the school board, but I can tell you my impressions of that. Personally, implementing an incident report system involves many considerations. Right now, given our current strategy, reporting cases in schools is going to be incomplete, potentially inaccurate. So we will not be formally tracking cases in the schools in that setting. We'll certainly be supporting schools in their decisions with respect to their absenteeism rate. I think at this point, I'd encourage, I realize this is a very stressful time. I would encourage all families to inform their own high contacts should they become ill, isolate their own family, and that's going to be the safest way to keep our school setting safe.
One thing that I've noticed is the number hospitalized on the dashboard for the health unit is different than what is hosted or what is on the dashboard for the Brant Community Healthcare System. Is there a reason why there's a discrepancy, or are we hospitalizing people from outside of this region?
We had a discrepancy last week that was corrected. Sometimes there are hospitalized individuals from outside our health units that are hospitalized at BCHS. So there is often a discrepancy because of that. And so I expected that's why there was a slight discrepancy now.
Okay. And now in terms of the outbreaks locally, I know we have a few homes that are in outbreak. Is staffing okay in these homes that you're aware of? Or are there any issues with shortage of staff being able to provide care in long-term care here?
I think across the board in the health sector, there are profound health human resource challenges. And so through outbreaks, we are certainly in constant conversation with long-term care as well as the hospital and helping to strategize outbreak management and also to triage ways to make sure that the staff is maintained. So this is actually a constant challenge across the board in all healthcare sectors at this moment, and we're having to actively help triage to manage staff levels.
And just one other question. Some people are talking about a boost or a third dose for those ages 12 to 17. I'm just wondering if that is something that you think will have come forward in the next little while.
We're still waiting on recommendations back to the 12 to 17 age group, and certainly your guidance from the province on that. But we will certainly wait for guidance either at the national level or provincial level before we vote on that.
Okay, thank you. That's it for me.
Can I ask one more question?
Sure.
It just strikes me. I remember probably a year and a half ago listening to somebody down in Halden, Norfolk, explain to me contact tracing and the amount of work that goes into it. And it strikes me to ask, how is your staff doing at the health unit in terms of, morale, sickness, time off, sense of burnout? We sometimes forget the people behind the scenes who are doing all these phone calls and following up here, there, and everywhere. And just how are they making out? How are they doing?
I would have to say that there's been I have been here for about 4 or 5 months, and I've been constantly impressed at how dedicated the staff is at this institution. Since I've been here for 4 months, they have constantly pivoted back and forth, including aggressive contact, vaccine strategy, and so things have been more challenging. They have had to work harder, and so I would have to say everyone in this province is digging deep, and that certainly is true for the health unit. But the dedication is still there. It's consistent. I've been very impressed since I've been here. How dedicated people are.
Okay. And I gather that would be the kind of approach people have to take now as individuals and families in terms of, trying to prevent the spread themselves. Take ownership of your own health in a sense to make sure that you're staying home and doing everything. Is that almost what we're saying here? Take ownership of it?
For an individual here, I would say that we would think of it like we've been thinking of other illnesses in the past. We stay home when we're sick. We take care of ourselves. We get help when our symptoms are severe. We don't wait. We get the best of that phase, but isolate ourselves so that we don't continue to spread it. And that basic message that everyone's done before will help everyone out if we all do it together.